Good afternoon, ladies and gentlemen. It is my pleasure to share with you our experience regarding implementation of ethiodized oil to treatment of infertility that is related to endometriosis. I will show you results of our study from the first year of treatment after we start to do this technique. And the paper is from Center of Postgraduate Medical Education, and co-authors are Dr. Ruta and Dr. Kuźmińska. As you know, endometriosis is a very difficult disease to treat. There are many recurrences, there are many problems. Patients have impaired fertility very much by this disease, and there is also high recurrence rate. The disease is quite frequent in general population, and about 50% of infertile patients will have endometriosis. We have reviewed immunological factors that lay down in the background of endometriosis related infertility, and there are many abnormal phenomenon, abnormal mechanism processes that take place in infertility impairment, and they are related to these ectopic lesions. There is also a group of treatment that can be effective potentially in future in treatment of this infertility. For many years, in vitro fertilization was the method of choice in endometriosis, but the method is not very successful in older patients with endometriosis. The pregnancy and birth rate are very low. And as you can see, the endometriosis infertility gives worst prognosis in the treatment of infertility by in vitro fertilization. This paper from Human Reproduction shows us that if you use different stimulation protocols, the cumulative pregnancy rate of in vitro fertilization, even if you make several transfer, it will be about 20%. So it's much lower than in other causes of disease. And also, in vitro fertilization, we have to remember about many complications that were summarized in European Andrology. European Urology Association in 2021, and there are a lot of evidenced obstetrical complications, neonatal complications, pediatric complications that are related to in vitro fertilization. So we should also, for medical reasons, avoid this technique when it's possible. The other technique that can be implemented in endometriosis is also surgery, laparoscopic surgery, and avoiding all these pathological lesions. And this technique is also good, gives good results, but it's risky for patients and and it's more expensive also to prepare to train operator for such surgery. It usually takes several times. I learned about 5 years to be very skillful in such techniques, so it takes time and money. But the results are better. Even 80% of endometriosis patients can conceive after such surgery. But there is also some information about new techniques like ethiodized oil that can be used in endometriosis patients to improve fertility. And as you can see, this article from Fertility and Sterility 2020 show us that lipiodol oil can be more effective than surgical laparoscopy and surgical laparoscopy with antioxidants. Other strategies, other pharmacological treatments are not successful or even can decrease the fertility in patients. But implementation of ethiodized oil give you improvement from 2 to 28 times from the basal fertility in given patient. Lipiodol is very old drug. It have more than 100 years. This is the structure of lipiodol. It's a ester of organic fatty acid that comes from poppy seed. It's also connected with iodine. There is a lot of iodine in the molecule in this molecule, and the structure is very different from traditional contrasts that are used for radiology. And lipiodol was used for many years for HSG to see the patency of fallopian tubes through the RTG, through the X-ray. And it was revealed that the fertility improvement in general population is significant, but the real revolution was to divide patients to different groups. And when there was a comparison between endometriosis and idiopathic fertility, it occurred that when we implement ethiodized oil in endometriosis patient, the improvement is very impressive. In a study by Johnson, there was a 4.4 time improvement in pregnancy rate and almost 4 times in birth rate. This is the first study that divides patients into the categories. And as you can see, in the first 6 months, almost half of the patients conceived after the administration of lipiodol ethiodized oil to the fallopian tubes. In the control population, only 10% were pregnant in the same period. As you can see, unexplained fertility was also treated by this ethiodized oil, and the improvement was also significant, but not so fast than in case of endometriosis. There are a lot of studies that show significance of this improvement of fertility. Cochrane meta-analysis and H2 oil study that show that there is significant improvement in idiopathic infertility as well. Also, the ethiodized oil can give you better visualization and less side effects than normal contrast. What we done in our center is to implementation of ethiodized oil to sono HSG, that is done not by X-ray but by standard ultrasound. And we used a normal kit that is used for sono HSG with a set of 2 syringes, and the oil have to be shaked before administration, because we want to see the bubbles that are floating into the oil, and we can see the patency of tube very well. I will show you our cohort. This was the cohort of patients that were treated in the first year when we started this method in our center. We have results from 68 patients with surgically or ultrasonographically confirmed endometriosis. As you can see, the age of patient was 38 plus minus 5 years, and the age of pregnant women was lower, about 2 years lower, and patients were infertile for a long time. In general group, almost 4 years, but as you can see, the treated group, the successful group, was even the time to conceive before our treatment was even longer. So it's very interesting. And in our group, 10% of patients conceive in the first cycle after the administration. So it's the fertility is almost as in general population. In 3 months, 20% of patients were pregnant, and in half of the year, 46 patients from treated group were pregnant with natural conception. What is also interesting, a lot of patients report alleviation of pain symptoms, but not all, unfortunately. As you can see in this graph, the fertility improvement is highest in first 6 months after the administration. And right now we have more than 200 patients that were treated in our center by this technique. The complications are rare. Severe pain is the most frequent complication in treated patients. About 2% of patients have this severe pain that have to be treated after the operation. 1% of patients have usually mild thyrotoxicosis. Ectopic pregnancy occur in 4% of pregnant patients, and miscarriage in 9% of pregnant patients. So these numbers are really similar to general population in our country. What are the mechanisms of action of this ethiodized oil? We really don't know, but a lot of work is done by mechanical flushing because this oil is very dense. And when you put this oil into syringe, you see how dense the oil is. And this dense oil, when it is transmitted by fallopian tubes, it make mechanical effect on the tubes. There is also immunological processes that take place after the administration. The oil is bacteriostatic because it contains a lot of iodine, but also immunomodulation takes place. There is a change in pattern of cytokines, lymphocytes, macrophages. The receptivity of endometrium also changed. As you can see, after the administration, we never do such early laparoscopy after the administration, but we have photos from literature. The oil is in the form of small droplets in places where endometriosis lesion usually occur. And after 1 year after administration, this is our own photo, we see that the ectopic lesions are fibrotic. The immunological effect after the oil administration really destroyed the superficial lesions. Sometimes the deep lesions have to be excited after this treatment, but the superficial lesions that really disturb the fertility are usually gone. We also know that administration of lipiodol increased the number of uterine NK cells that are very important for immunotolerance of early embryo. In concluding, to conclude my topic, we also have to remember that the informed consent have to be done by patient, and the patient have to decide by himself or herself, taking into consideration her or his beliefs in the first place. But the effectiveness of treatment is also important, and novel immune-based problem-targeted therapeutic method can be really effective and safer than standard IVF. And I believe that lipiodol is really breakthrough in the topic of treatment of endometriosis-related infertility. Thank you very much for your attention. If you want, I will be available in question and answer session, but you can also contact me by email that is here. Thank you very much.